All right, welcome everybody to another episode of Achieve 10X TV. My name is Jimmy Yin. I'm a licensed acupuncturist, herbalist, and nutritionist. And this series is our health expert series where I'm going around the world, not just the US, but around the world. And I'm finding specialists and experts in their field. And today I'm super excited to have an expert and acupuncturist who specializes in sports performance, and this can be for athletes or weekend warriors. Jon Kukor. Am I Kukor, or am I saying your last name?
Yeah, no, you're perfect. Yeah,
Kukor. All right. So, Jon, why don't you introduce yourself?
Thank you, Jimmy. So yes, as you said, my name is Jon Kukor. I'm out of Orlando, Florida. The topic here today that I'm really excited you invited me to talk about is acupuncture for sports performance. Personally, I have a lifelong addiction / interest in athletics. I've been very active throughout my life, so I know firsthand the benefits of this. And I just kind of want to talk about some experiences, some of the things that I've seen that just regular people maybe not know of. I've worked with weekend warriors, professional athletes, run the gamut of people everywhere. And there's so many different things that we can utilize acupuncture for with regards to athletics. I think it's really exciting.
Nice. So let's talk about, athletes first. Since you said you worked with athletes, like professional athletes, and then we'll talk about the weekend warriors, because that's probably a majority, 99% of the world.
Okay. Totally. I've been very fortunate here in Florida. We have a lot of professional athletes, whether they live here full time or they are here in the off season, that have a residence down here due to the weather and then, possibly tax reasons. But we have a really large base. So we also do have professional sports teams. We have a soccer team here called Orlando City Soccer. I have worked with several of the players there previously. I am affiliated with an MMA gym that I've worked on several people that are in the UFC there that are up and coming, pretty exciting. And I've worked previously with a couple MLB players and some people from the NFL as well.
Nice. So what are some of the common things that these professional athletes come to you for?
So it's pretty interesting because the way we look at it is different sports will lean towards different injuries, if you will. So soccer players, for example, very often they have hip issues with all of the running that they're doing and the kicking. And it's a very physical sport, actually. So there's a lot of contact, falling down, that sort of thing. So a lot of times I find issues with their quads, their hamstrings, their hip flexors, their adductors, the muscles on the inside of the leg, and that whole pelvic girdle, as we call it. So that's one of the things I really like to focus on for soccer players. With anyone I do an evaluation. And then I've worked with MLB, for example. Let's say I worked on a baseball pitcher. So a lot of shoulder issues. Anyone who's ever played very serious professional baseball will admit that the human body was not designed to throw the ball 100 miles an hour. It's an amazing feat, and a lot of people do it very well, but that takes a tremendous toll on the body. And as a result, it's really important to utilize certain techniques to continue to take care of yourself, because at some point, no matter how good you are, you're going to be done with your sport, and you want your quality of life to, not really be affected afterwards. You want to be moving around well, you don't want to be in pain at night, those sorts of things.
Yeah, it's interesting you said that, because there was a documentary probably years ago about NFL players, with the concussions. And it's they spend just a small portion of their life and they're getting hit, and then now they're suffering for the rest of their life. So that leads to my next question is why do these athletes, these professional athletes come to you? What's their reason?
That's a really good question. So acupuncture is still, as a profession, not really at the forefront. We're getting a lot more acknowledgement, and a lot more people have at least heard of us now, whereas 10, 15, 20 years ago, it was still kind of in the back burner, and people, for the most part, probably didn't even really consider it. The reason these athletes are coming to see me or other colleagues of ours is because the team physician, the team medical team works only under certain parameters. And they may have somebody on staff. I know some people that do work for teams, but in general, to really get the best treatment, unfortunately, athletes, I've found, and from research and talking to people, have to generally seek outside care because the team physicians, they may have a chiropractor, they can only do so much. They're working for the team. They're not working necessarily for the athlete as well. And many times working for the team, they may have the team's best interest over the athletes, which the athlete is essentially a commodity, and their goal is to get them out on the field, or court, or whatever they're playing on. So it might not be, hey, this is your long-term health answer, which I will look at with my patients. It makes sense?
Yeah, no, that makes perfect sense. I mean, it's a different perspective. I mean, if you're not a professional athlete, then you probably may not know that. But as a avid tennis player myself, I grew up. I started late, but I knew a lot of friends that they wanted to turn pro, so they started playing tennis, at 5 years old. And so they should, based on what you just said, use acupuncture as a way to maintain their health, because like in the tennis, professional tennis, even if they get sponsored, it's not like they get sponsored for their health. They're responsible for their own health, right? So that's kind of the bridge. So you talked about professional athletes. Then now let's talk about the athletes that want to be professional. What should they do in that situation?
Yeah, great question again. So if you are a high level athlete, let's say you haven't made it pro, maybe you're a high school athlete, maybe you're a college athlete, something like that. Acupuncture, as far as what we call maintenance, so even if you don't have, say, pain, just the repetition of your activity is going to create imbalances throughout the body. So that's why it's really key, before those imbalances lead to some issues in your hip and causing an ankle problem, for example, that you get continuous care just for what we call maintenance, and just look at those problem areas. And there's kind of sport specific treatments you can do, like what I was talking about before. The different sports will impact certain areas more than the other, but I think that is a very good way to do it.
Yeah. So what other ways? So you're looking at professional athletes are looking at when they get injured, so they come to you, and also to keep them. You're saying that you want to keep them, on the field or on the court, and that's why they need to continue to see you, because they're going to continue to play. That's how they're making their living. Yeah. And so these up and coming athletes, these high performance athletes, I've got a patient right now who's a swimmer that may be swimming for the UK swim team, the Olympics team. And so you're saying that even if they don't have any ailments, they need to continue to get regular acupuncture treatments. Why is that? What does acupuncture do that's different from what their strength training?
So any just repetition, continuous exercise will, like swimmer, for example, let's say you're doing crawl strokes. So you're moving your shoulders, your rotator cuff muscles, yep, your deltoids, all those muscles. I mean, you do use your legs and your core as well, but just tremendous amount of work. And I mean, depending upon their event, I mean, they're probably doing several miles a day, I'm guessing.
Yeah.
Like a lot of really intense swimming. So the reason is we're talking compared to somebody that maybe walks half a mile, like this is like Superman level of activity. I mean, this is insane. So they can do it. They are able to push their body through building up over time. I'm sure probably start very young at 3, 4, or 5, maybe even younger. And it's been a lifetime progression through this. But your muscles are continuously breaking down. And with this repetition, there can be something that very often they experience, which is called motor muscle inhibition. So the muscles are technically not firing as well. It's not necessarily that they're weak, but the motor nerve that fires that muscle and has it act strong, if you will, that is inhibited through all this repetition of activity. So anytime you have a tremendous amount of activity, you are highly likely to get this motor muscle inhibition. The range of motion is generally impaired as well, and acupuncture can help to move the fluids and help to release the connective tissue fascia. Many people hear about nowadays. It's a more up and coming term. A lot of research coming out about that. Acupuncture can help to relax these things and help to open it all up, and different even than just going and doing stretching, for example. Stretching can be great, but the insertion of the needle, it has not only a systemic effect, but a localized effect where you insert. And if you as a clinician are very specific and very tactical about your approach, you can get really phenomenal results, which then the athletes will see in their performance.
Nice. So if I'm hearing you correctly, is these up and coming athletes, why they should seek out acupuncture is to really maintain their performance, maintain their top level performance, because they're trying to become professional. So they need to be on their game all the time. Like they don't have the time to be off one day, right? Because that could determine if they become professional or not.
Yeah, no, 100%. Here's the thing. I mean, like a lot of people probably don't realize this either, but so professionals, and I think pretty much across the board, doesn't matter who you are, what sport, but pretty much every professional that I've talked to about this, if you are on a team sport, you get injured, there's a guy right behind you who's there, like ready to take your spot, and you lose your spot, like that could be a lot of money, and then you got to fight to get it back. So you don't want to take any time off. You want to be there as much as you can. You don't want anyone to forget how well you performed in the past, because that only lasts so long before a guy right there behind you that's coming in getting it. And like you touched on with an up and coming athlete, I mean, you have to really work to get your foot in the door and to get noticed and get that recognition. So once you get in, you don't want to be there and be like, oh, now I'm not here anymore. And then you're already out the door as soon as you got in.
Exactly.
No?
I think that was Tom Brady's story, right? I think he was a backup quarterback, and the main quarterback got injured, and he took over. Tom Brady took over and never let it up.
Yeah, absolutely. That was totally what happened. Great example.
Yeah, so that's a great, because I mean he's obviously one of the best ever quarterbacks ever in the NFL. So yeah, so for for athletes that are up and coming and want to get into that professional level, definitely want to use acupuncture to maximize their performance. So let's talk about the weekend warrior. Okay, so like the rest of us who we wished we were professional, we will never get there.
This is a group that really excites me because this is where I am in my life. So, so I can definitely speak from this place. So let's take the typical weekend warrior. We'll say they work the 9 to 5 job, as they call it. They're at a desk very often. And a lot of our strength, no matter what activity we're doing, comes from our core, our glutes, that midsection area. So tennis, you're doing a backhand, rotating on your serve. Golf, that rotation we go through is swing, baseball swing, all those. You're using that whole area. So getting back to, those of us that are sitting, working at the desk, um, kind of like I touched on earlier about that inhibition of the muscles. So what are we doing? We're sitting. We're sitting on our glutes, our behind, and doing that continuously, 8, 9, 10 hours a day, 4 or 5 days a week. The body's not meant to sustain that. So when we're doing that, your glutes literally get shut off. And again, it's not that they're weak, just the nerve is not firing there appropriately because of all the compression from, let's say, your 200-pound person sitting on that over time, and that gets the nerve, not the motor muscle nerve, not firing optimally. So what we do is, in that case, we test the area, go in, do very specific techniques to restore it, maybe incorporate some soft tissue work, because unfortunately we are in the field of acupuncture, but there's so many things within that field we do. So it's not just all about putting needles in. There's many other things that can be done.
Yeah. And we'll talk about, and I'll have you talk about that in a second. So you mentioned, sitting. So most people are sitting, 8 to 10 hours. Like my wife, she's a CPA, so she'll sit 12 hours a day. If I don't, find ways to make her get up, she will sit throughout the whole time. And so what can people do? So knowing that people, it's their job. They're going to have to sit. So what do you usually recommend your patients do, knowing that they need to sit, but then also they're a weekend warrior? So what do they need to, how do they, remedy that?
So when I have people in a treatment program, I assign them homework, which may not sound like the most exciting thing, but if you want to get better, you got to be vested in the treatment.
Yep.
So I assign them some specific exercises, which I will have them do at home. I'll check up, make sure they're doing okay with it, if they have any questions. But additionally, what they can do, and I know I've worked in the corporate environment previously, so it can be easy to get caught up and forget about this, but you can set a little timer every hour. Just get up for 2, 3, 4 minutes, just walk around a little bit just to release some of that compression that's going on. That's something that I generally would recommend, because people really don't think about this and probably are very rarely aware of it. And as clinicians, oftentimes we just assume people know these things, but they don't.
Yeah. So would it make a difference? I'm just thinking, would it make it, with the inhibition of the nerve, would it make a difference if we have a little more padding in our butt?
Yes and no. I don't think that's, from what I've seen from research and from clinical experience, I don't think that makes a tremendous amount of difference. I see what you're saying, because I've seen people with a more developed lower body, if you will, still experience the motor muscle inhibition that I was speaking of. But because also if you look at that, most likely they could potentially have a lot of weight in their upper body too, that's then sitting on the larger lower part. So I'm trying to tiptoe around it here.
All right. So you talked about, acupuncture. When you work with your patients, needles is not the only thing you do. So what are the things do you do to help, all of these 3 classes of athletes?
Okay. So what I'll do sometimes, there's a technique called gua sha, which some people may be familiar with. A lot of physical therapists do a very similar technique. They call it Graston. Some people may know it by that name. So what that involves is, generally I'll put a topical on, so a little oil that will probably warm the area, and then I'll go over it with a device and just do a little light scraping, which probably sounds a little weird saying that, but it feels tremendously good. And what that helps to do is break up adhesions in the tissue, and also furthermore increase blood flow in the area. And that combined with the acupuncture can be a really good combination. Depending upon what I see, Sometimes I will do some sort of cupping. I also do several different manual techniques, which may involve like 30 seconds of a little light compression in the area. And will do what we call a passive movement. So I'll have the patient just let me grab, say, their leg, and I'll move it in a certain manner without them exerting any energy. And then I'll be pushing like lower back. There's one that I do for a muscle called the QL, the quadratus lumborum, that I will push there. And, no needle involved with that, but that technique works very good as part of the treatment.
Okay, nice. So is it possible for an athlete, let's say an athlete, or a weekend warrior, probably athletes, they'll do whatever they need to do to get to the next level. But weekend warriors, we're not getting paid to hurt ourselves, okay? And so is it possible that you can still help these weekend warriors without needles?
Absolutely, definitely. I can do some of these techniques, acupuncture, and very oftentimes I do a little bit of light electric stem with it. However, if that is really not for somebody, there are other techniques that probably won't work as quickly, but other techniques that I know that are very efficient, utilizing some of the same strategies. So some of the things I've touched on already with restoring the function of the muscles, like that hip girdle area that I spoke of the soccer players. There are things that we can do without utilizing needles to restore function to that area. Absolutely.
Okay, good. And I'm just thinking, okay, what could, what are some of the questions that some of these weekend warriors will ask? One of them that I get asked a lot, and I just want to see, what your experience is. They, like say, we have a lot of golfers, and so their number one thing is, if I'm getting treatments, do I have to stop playing?
I would say on a case-by-case basis. Normally, I'm okay with it, but let's say golfers with that torsion of the swing, and depending upon if they're a Happy Gilmore type person and they're coming in and they really want to launch the ball off the planet, they might be putting a lot of torque on that lower part of the back. And let's say we're seeing them for an acute back sprain. So that might not be ideal while you're in that really acute. So meaning, boom, you're 10 out of 10, like it just came up. This is not a long-term problem. This is something that just really spiked up. So in that acute phase, it might be necessary to cut back for a little bit. We would do an evaluation and that would dictate which course we take. But oftentimes people can continue their activity, especially the weekend warrior types, and receive treatment.
Okay, nice. And the next question that people will ask is, how long will it take to get results? How long will they, start to see some improvement?
So as far as that, generally what we will do is twice a week is generally the optimal treatment course. And generally I'll do twice a week for 3 weeks. Do a reevaluation after that. Oftentimes with these techniques, I mean, it depends. People are in different states. People's bodies heal differently. But oftentimes people will see really phenomenal results well within that period. But just the nature of how soft tissue heals in the body, it's important to stay that course, because even if you're feeling better, there's still this process that the body is repairing itself. And so that can go two different ways. People can feel really good and say, oh yeah, I'm back to 100%. Yeah. And then boom, we're back to square one because they've re-injured themselves because they feel so good, they forget they're still recovering from injury. Or, we don't get enough treatment in that they get better, but then, we only do 2-3 treatments. And then that actually isn't enough, even though they feel better, because we got rid of the pain, we started restoring function. We still need to help the body along during this soft tissue recovery phase. And if we stop too early on that, then we plateau and we don't achieve, the apex, the top area that we really want to hit to get them to their best spot.
Okay. So let's say that, you've helped them get really great results. They feel great. Um, then some people say, oh, even, when they feel great and they're actually playing and they're going back to their sports and they're playing, no problems. Do you stop right there? Because most patients will say, well, I'm good. I'm good to go. I'm playing. I'm back to doing it. I don't need to come anymore.
Right. Yeah, and that's I find that can be the perception. And again, it might be our fault as practitioners because we just assume patients think, oh yeah, they know, but that's not really the case. So they're going to continue their sport, and most likely, a lot of sports, if you're doing it very regularly, you're going to get an injury. That's just part of sports. So going into a maintenance phase after that, after we take care of the injury, and that could be depending upon how intense they're doing it, and just their overall makeup. It might be something like come in once a month. It might be come in once every 2 months. It really depends. We evaluate on a case by case basis. But yes, staying with a consistent treatment plan, and then, looking at how that can help you to stay in the game.
Yeah. So let me summarize what you just said. So basically for these weekend warriors, you're going to help them get them to where they want to be. And where as the patient, they're going to feel great. They're going to be playing their sport again. But you recommend that they continue the treatments because almost similar to those professional athletes is the key is to keep them playing. And the maintenance treatments will really help them either keep them playing at a high level, or maybe even help them if they do get injured, they'll be able to recover a little faster, right?
Yes, absolutely.
Okay, awesome. All right, John, we're coming down to the end. Is
Wow.
there yeah, I think it goes by fast.
Super quick. Yeah.
So any last words that you would like to share?
Yeah. So one other thing that really think is important to touch on is kind of the old saying, "You are what you eat."
Yeah.
And I find a lot of athletes, are, let's say, in their early mid 20s, maybe 30s, especially if they're a high level athlete. And I know I was probably guilty of this at that age, but they don't really understand. So you go to McDonald's a few times a week, you're putting like literally something with next to no nutritional value in your body, like absolute garbage. And
No.
that goes to a cellular level, that goes throughout your body to all your body fluids, your blood, everything that lubricates your joints. It is all nourished by the food that we put in our body. So that, and then also the way as practitioners of traditional Chinese medicine, we have the ability to look at foods and very specific properties and influences that foods can have on the body is something really cool that I think we bring to the table. I know we don't really have time to go in depth on that. I mean, that could totally be a different video just on itself.
Yeah.
But that is something that's really, really important because diet, sleep are right up there, probably the threefold: diet, sleep, and then you got your training there. I'd say very equal portions of all of them. And if they're not in line, you're not going to be where you need to be. I mean, you talked about Tom Brady. I know a lot of people kind of laugh about it, but I mean, that guy's diet, and I'm not fortunate enough to hang out with him, but I'm going to guess his lifestyle and sleep schedule and everything is up there. Like, you can't top it. I guarantee it. I mean, he's 42, I think, and playing the level that he is.
Is he the oldest quarterback playing right now?
I don't know. He's close. Him and Drew Brees are like really close in age. I'm not sure off the top of my head who's older, but he may be.
But you can tell, I mean, the difference, the performance
Right.
difference. There's
Yeah.
a huge gap.
Yeah. It's amazing.
Yeah. Yeah. So it sounds like, so not only how you help your athletes is not just with acupuncture and also the physical treatments, you actually help address the two other components that you mentioned, the sleep and the diet, which is crucial to the longevity of their career. And the training, obviously, they got to do themselves, but you help with actually 2/3 of their performance through Chinese medicine.
Yes, definitely. It's a very key component and way too overlooked.
Yeah, yeah, that's awesome. All right, thanks, John. I appreciate your time, and yeah, we can do a whole another episode, talk about nutrition. We can go in deeper and how you use nutrition to help your athletes. But for now, again, I appreciate your time and thank you for what you do for the athletes. And where can people find you?
So my website is orlandoalternativehealth.com, obviously in Orlando, Florida.
Yeah.
But I've got all of my information on the website, social media, all the good stuff there.
Okay. So I've tagged you in the post. So if you can put that into so people can find you.
Totally.
All right, John. I appreciate it.
Thank you so much, Jimmy.
Okay. Thank you.